In this video, I am going to discuss about the Down syndrome, that remaining part, and this is our last part. Okay, so differential diagnosis and the treatment we discuss in this video. Let's start. The differential diagnosis in that we have congenital hypothyroidism. Second is Robertsonian trisomy 21, and third is the partial trisomy 21. So in Down syndrome differential diagnosis, we can do say that is congenital hypothyroidism, Robertsonian trisomy, and the partial trisomy. These are the differential diagnosis of the Down syndrome. Next, the treatment. So basically in treatment we include the lots of therapy, okay, and lots of team members. We cannot give the treatment only surgical or either only physiotherapy. The combination of the management is required in the Down syndrome patient. So first is educational therapy, then speech therapy, occupational therapy, psychological support, surgical treatment, medical treatment, and the last is our role, that is physiotherapy treatment. So these are the certain team which help to develop or the maintain a good quality of life into the Down syndrome patient. Let's discuss one by one. So first is medical management, which is which drugs, some of the drugs which used in Down syndrome patient, that is antioxidants. So in dementia, but not much effective. The Down syndrome patient have dementia, so we can use the antioxidants, but it is not much effective. Then second is thyroid replacement hormone, because in Down syndrome patient, maybe one of the causes is the hypothyroidism, so we can provide the thyroid replacement supplements into the child. Then third is the amino acid supplements, then other supplements like vitamin B12 tablets, okay, other vitamin and the nutritional rich food, or we can modify the diet also. So these are the certain medical management in the Down syndrome patient. Then second is the educational therapy. So educational therapy basically given to the some juvenile child, okay, or the adolescent child. So that is the professionals in this team which provide this special program to the children and their families also, because the family has more role to support the child. Okay, the professional which is highly professionalized, which give the special program to the child and family also. So this is the role of the educational therapist. Then third one is speech therapist or language therapy, which uh, develop the early skills for the communication. Okay, they promote the child confidence for the communication into the society level, at the school level, family level, okay, or in other functions. So they develop the communication skill into the child and develop the confidence also. So this is the role of the speech and language therapist. Then occupational therapist. So basically the occupational therapy teach the self-care skills like eating, dressing, combing, washing, okay, cleaning of the parts. So these are some self-care skills which develop in child by the occupational therapist, okay. So they help to child to develop the specific key skills, okay. Then help to teenagers to identify the jobs and put in into the particular job, and they develop a specific skill also, so they can do job easily. So this is the role of the occupational therapist. Then psychological support or psychological therapy, which is provided by the psychologist. They help to child to deal with the emotions and anxiety and help to other personal and professional skills also, because Down syndrome patient have anxiety and emotional problems. So psychological support that require in Down syndrome patient. So it is the major role of the psychotherapy in Down syndrome patient. Then surgical treatment. In sign and symptoms or the one of the cause of the Down syndrome, we see that the congenital heart defect is more common in this type of patient. So the 40% child with the Down syndrome have a CHD, that is congenital heart defect, that is like tetralogy of Fallot, VSD, ventricular septal defect, okay. So these anomalies require the surgical treatment. Next is our rule, that is PT management. So certain goals that are improve muscle strength. Okay, for muscle strength, because in Down syndrome patient the hypotonicity is more common, so the muscle strengthening is important in this type of patient. So we can give the resisted exercise, okay, that improve the muscle strength. Then we can give the manual resistance also. Then improve balance. So for balance, we can give the balance board activity, then proprioceptive training to the child, physical exercise. Okay, so this is a certain activity which improve the balance into the child. Then reduce secondary joint problems. That is one of the cause of the joint or the bone of the fracture, that is osteoporosis type of symptoms, that is fragile bones which is present in Down syndrome patient. So we can give certain spleens, okay, orthosis, so the other deformity we can prevent. Then promote to achieve gross motor skills like sitting, crawling and standing, etc. Because the developmental delay which is very much common in Down syndrome patient, so we can help to the child to achieve their specific skills like which is required in ADL, that is sitting, crawling and standing, etc. Then manage the hypotonicity. Then maintain good posture, uh, increase body awareness. Okay, so the body awareness is very much important because child sometimes get the abnormal posture and that leads to other deformity in the child. So we can improve the body awareness. Then we can strengthen the core muscles also, so that help to child into the sitting activity. Then we can give prone on ball and recharge activity, prone on boards, then superman exercise. This other techniques is also given to the child, so that improve the body awareness also. Then facilitate the feeding techniques into the small childs, or we can say infants. Then gait training. Then for gait training we can give treadmill gait training, okay, then obstacle walking, tandem walking, side to side walking, okay, walking with orthosis. So these are the certain criteria that given by the physiotherapist, okay. Then play therapy activities, because the child have developmental delay, so they have fine motor activity problems, so we can give the play therapy techniques, pegboard activities, okay, then play with the toys, keys, etc. Okay, so this is about the physiotherapy role into the management of the Down syndrome patient. Thank you.